Thank you, President. I'm pleased to join the debate on the Health Legislation Amendment Information Sharing Bill. I also just want to start by thanking Dr Mansfield for her contribution. I thought it was exceptionally thoughtful and I think gave us an insight into the realities that our health and medical practitioners face on a day-to-day basis that's really been absent from some of the contributions from the other side of the chamber. I do also want to just acknowledge the small matter of my partner's employment in a medical service that's reflected on my register of interests, and also share the sort of lack of concern that poses any conflict of interest. But it is important to state in the context of this debate that we do see our health practitioners constantly trying to do the absolute best that they can for the patients that are presented to them on a day-to-day basis, often in very difficult circumstances. And what we as legislators and government can do to help give them the tools and information that they need to provide the best quality care is something that should be top of mind, always in consideration of legislation that's before us. And we know that better information, complete and as accurate as we can make it be, may be a necessary but perhaps not sufficient ingredient in ensuring that high quality of care. The bill before us today does a range of things, including enabling the Department of Health by amending the Health Services Act to allow for information share, to create and establish an electronic health information sharing platform, to allow the sharing of information between specified health services via that secure platform for the purposes of treatment and patient care. And it also facilitates the Secretary of the Department to have the necessary powers, controls to allow that process to occur, and introduces new offences, new requirements, new penalties for unauthorised access or disclosure of that information. The bill and the legislation, when it is passed, and we hope that it is passed, will sit alongside the very significant protections that exist in the Health Records Act and under the 5 health privacy principles to ensure that the use of health information in Victoria is both properly and well regulated and also has sufficient and necessary oversight. And I think the government does take those concerns seriously, and clearly in the discussions with other members of this place and other members of the other place have certainly been very willing to make sure that the sorts of oversight that is put into this framework is the best that it possibly can be. The other thing I wanted to just reflect on is, and this is something that I made a contribution in the chamber last night about the work that we have done previously, and I've had the personal experience of working on in another sensitive context, that of the family violence reform context, and the information sharing that the government put in place following the coronial inquest into the death of Luke Batty and the Family Violence Royal Commission in 2016. And what was clear to us, arising from the recommendations of both the coroner and the Royal Commission, was that the lack of facilitation of information sharing between practitioners that are involved in support services for victims of family violence in that case, and we can draw an analogy here to the provision of patient care in our health settings, was that the lack of that facilitation had the potential to increase risk, because an inability to see the full picture meant that the decisions that those who were trying to help needed to make sometimes weren't fully informed. And when we have a lack of information, we can only make the best decisions possible. Health practitioners in this case, with a lack of the full information, can only make the best decisions available to them. And I think it should be within the capacities of our government of governing and providing the necessary legislative and technological support to our medical and health professionals, that they are provided with all the tools that they need in order to provide the best possible quality care to patients. And in approaching the task of thinking about this challenge in family violence, but I think it's applicable here in health as well, is we need to think less about the health systems that we have in place and more about the people who use them. Because always, the operation of our health systems and the technology that supports them should be developed to consider the lives of the people that they're trying to help, to deliver a seamless patient experience, but also to provide the best possible care. And it's one of those features that I think is the most striking impacts on the provision of that high quality care that this bill is trying to address. That at the moment, because of decisions that were taken more than 20 years ago about the structure of our health services in Victoria, and I'm not going to the merits of those decisions, I'm just looking at the consequences of the structure of Victoria's health system has on patient experience and the quality and the potential of the receipt of high quality patient care, is that by having effectively autonomous health service regions that have their own boards with their own structures, that have their own information systems in place, what we have allowed to occur in Victoria is a siloing of information within the boundaries of those health services. And I've got to say, I've not met many patients who understand what a health service is, let alone know which health service they're turning up to when they're sick and need care at a community health centre or at a hospital. And that they're less interested, frankly, in the way we choose to draw lines on a map than they are about getting the best quality care. Because what we have seen in Victoria and what the Targeting Zero report laid out in such stark terms is that the structures of the bureaucracy shouldn't be impediments to patients receiving the quality of care that they need. And that allowing by this Act, facilitating through the use of modern technology, relevant information to be securely transmitted from one health practitioner to another to enable best practice high quality care to take place is something that should be within the capacity of a state and a state government that prides itself on having a world-class healthcare system. And that the healthcare that Victorians receive shouldn't be determined in its quality and efficacy by lines that were drawn on a map 20 years ago. And that's fundamentally what this bill is trying to overcome. The other thing I think that's important to recognise in the course of this debate, which I think has been sadly lacking from the contributions of those opposite, is that the current arrangements under the Health Records Act and the health privacy principles do already empower health professionals and clinicians to share information that they deem necessary for effective patient care. Effective patient care already allows health practitioners to share information. But as Dr. Mansfield so eloquently explained, the way our health systems are structured and the technology that they provide for clinicians means that often the tools that those health professionals have available to them are suboptimal at best. And if the fax machine wasn't becoming too much of a cliche in this debate, it is a very real feature of our health system here in Victoria, and I don't think that that's something that we should be proud of, and I think that it's a good thing that this bill is trying to do away with those technological restrictions on effective healthcare in Victoria. Because what the bill actually does is simply enable the facilitation under existing health law, new mechanisms for information to be shared. And the bill, in its current form and under the terms of the amendments that the government has circulated today, will be allowing increased oversight of those platforms, will be increasing the penalties for inappropriate use, including imprisonment, And most importantly, unlike the way things work now, where people pick up the phone, call each other, open a paper file, what we'll have now is a much more detailed and secure audit log so that patients are able to see who's been looking at their files, so that oversight can occur when we, if those in management or other positions of responsibility have concerns about these practices taking place, that there's actually something there to look at. Because at the moment, there's no way of knowing who's going in and having a look at a patient file when they shouldn't be. There's no way of keeping track of someone who might have less than honourable motives looking at, with improper purposes, someone's information. What the provisions of this bill will do is put in place more penalties and put in place better mechanisms for keeping track of whether or not that's occurring. And I think, and the government thinks under the terms of this bill, that that will be a positive for patient confidence in the operation of health records in Victoria. Because we do think that it's time we got with the program. We do think it's time that Victoria's health system moved beyond fax paper and started getting to technology that enables them and enables information, that enables a doctor in one hospital to know whether the person who's presented to them, whether they be from the city going to the country or whether they be from the country coming into the city, knows that this person has had a blood test in the last couple of weeks. That whether the person who has just turned up to the emergency department on a Saturday night, for example, has had a blood test, has a range of allergies, so that firstly those tests and unnecessary procedures aren't repeated, preventing unnecessary trauma on a patient who's required to go off and do unnecessary tests. Let's not forget that every time a doctor orders a blood test, a patient has to give blood. So if we've got the capacity for pathology to be shared more effectively between our health services, we might actually be providing a health outcome for patients that's much more better for them. And that what this bill will do is when someone turns up for treatment, it'll make sure that the treatment they're receiving is as fully informed as is possible, prevents duplication, reduces inefficiency, ensures that our doctors are spending less time rifling through paper, asking for stuff to be faxed to them from their colleagues if they can get hold of them at another hospital or another health service, and enables them to be making the kind of informed clinical decisions that they require to provide high-quality patient care. It brings Victoria into line with other jurisdictions. It does what's necessary to demonstrate our commitment to the continual improvement of our health services here in Victoria. It responds to key recommendations of the Targeting Zero report, which was all about trying to reduce avoidable harm in our health system, and make sure that just like in other settings that we've moved on, as I've mentioned earlier in the family violence context, but others, that decisions that professionals make are more fully informed by the resources available to them, that there's increased oversight, there's better protections, there are new penalties, and that the way that this framework is going to be operated and implemented will be subject to the kind of oversight and monitoring that gives this parliament the confidence that the government is doing what it says it would do, and most importantly, and it brings me back to my original point, that allows our health system to be designed and operated for the benefit of patients rather than the administration of a health bureaucracy on the basis of decisions about administration that were taken more than 20 years ago. I think putting patients first in our health system should always be our absolute priority.
Thank you.